Hello, I'm Dr. Ma. I would like to talk about braces today. So generally the braces divided into four types of braces. The first type is what we call the metal braces. You can see on the top left corner. Then the other type of braces is ceramic braces. Ceramic braces is just a transparent braces. From far you see them get a straight line. And as you get closer you see the square box braces as well. You can see on the top right corner. Then the other two types is what we call invisible and aesthetic braces. The first type is what we call lingual. You can see on the bottom left corner. Then the braces usually stick behind the teeth, so from front you can't see it well. The last type is what we call the aligner. The aligner is basically just a plastic cap. Then you keep changing the plastic every 2 weeks, then eventually they remove the teeth. But you have to remember, the braces all do one job. They're no different. They should give you a similar result at the end of treatment. Once you start the braces, regardless what kind of braces, you have to keep coming back every 4 to 6 week interval. Every visit, we're going to tighten the braces or changing the wire to something tickle, which means you can have pain or discomfort for 3 to 5 days. Then this will settle down. We're going to repeat the same procedure every 4 to 6 weeks until the teeth are straight, then the space are closed. This usually take about 2 to 3 years in total treatment time. Then once you're happy with the result, space closed, teeth straight, we're going to remove everything. Then you'll go into what we call the retention phase. So once the braces removed, the result usually not stable. If you let go of the braces without the retainer, then the teeth will go crooked again. That's the reason why we always give you the retainer at the end of treatment just to maintain the result. Retainer basically divided into two types. The first type is what we call removable. You can remove it and put it in yourself. And the other type is what we call the fixed retainer. For fixed retainer, basically just a piece of wire stick behind the teeth, so you cannot remove it. So a lot of people ask how long you have to wear this retainer. Really, the retainer is for lifetime if you want the teeth to be straight forever and ever. For some difficult cases, we usually put in what we call a mini screw or mini implant to reinforce anchorage. For example, if you want to push the top teeth backward, so to prevent the back teeth coming forward, then you need to put the screw at the back of the jaw just to prevent the back teeth from coming forward. So the screw only come in for difficult cases or more complicated cases. Braces come with many side effects if not careful. If you cannot brush your teeth well, then slowly you'll see the gum be swollen and they'll cover the braces. Once you remove the braces, you'll see the scar or decay or cavity. Then this could be permanent damage. So really make sure you can brush your teeth well. If you leave the food behind for too long, then they will form the calculus or the stone. This will cause the gum recession. Then if you take away this stone, then they will form the back triangle. So you can see from the picture, there's so many back triangles forming in between the teeth, even though you close the gap at the end. Then this could be permanent damage to the gum, because once the gum disappears, they are not coming back. The other side effect for braces is root shortening. So if you apply the force to the teeth, the body will respond in a way they will take away the root for about 2 to 3 millimeters. This happens to everyone do braces treatment for about 2 to 3 years. So the faster they do it, then the more the side effects going to be. That's the reason why we have to make sure we adjust the braces not too fast and the force cannot be too heavy, just to minimize the side effect. So you have to be patient with braces. You have to do it very gently, very slowly, just to prevent the damage to the root. When it comes to diet, you have to be careful with the hard food and the crunchy food and those sticky food as well. They will damage your braces. Every time you break something, they will delay your treatment a little bit. For example, people might finish 2 years, then you might finish 3 years. So the other thing is what we call the fizzy drinks. Coca-Cola, 100 Plus, Sprite, all will cause the damage to the teeth. So try to stay away from these fizzy drinks. If you drink too much of fizzy drinks, you'll notice they will attack the surface around the braces. Once you remove the braces, you'll see the square box mark. Then this is going to be permanent scarring to the teeth. So stay away from the fizzy drink for the next 2 to 3 years if you want to do braces. Brushing can be the most difficult job, but the most important job for the braces. Everything is something. You can have food stuck between the braces, which means you have to brush your teeth every single time after you eat. For example, if you eat 5 times, you might have to brush your teeth 5 times a day. Besides the normal toothbrushing, you have to use a special small toothbrush to go between the wires and the braces, which means you have to spend a bit more time for your toothbrushing, add an extra one step for your toothbrushing. Then you have to bring a toothbrush whenever you go. So let's say after you listen all these side effects, you think you can take it, and the time and the length of treatment, you're okay with that. Then before you start braces, we usually have to take some record for your teeth and your face. So the first thing is what we call the mold. You have to take the top water mold for your teeth. Then you have to take some extraoral photograph for your face, and then some intraoral photograph for your teeth, just before we start the braces. And usually braces, we need two basic x-ray, namely the OPG and the lateral ceph. So the OPG is just a general pictures of all the teeth, the length of the teeth, and any teeth still buried inside. Then the other x-ray, what we call the lateral ceph, you just look at the skull, the upper jaw and lower jaw length, and the angle of the upper and lower teeth. We usually have to repeat this x-ray every year just to see the changes and to see whether the root is doing okay or not. Then at the end of treatment, we have to repeat the same record like the photograph and the mold, just to keep a record how your teeth look like at the end of treatment. If you have any questions, you can always ask me during the next consultation appointment with me. See ya.